for some pregnancy prep, SI joint release, hip mobility to best prep your pelvic floor, your perineum, your lower back for birth. These are all obviously pregnancy safe, but these are also safe to do postpartum, and they're also safe to do during labor itself. So we're gonna start with a yoga block. You're gonna place it under one knee. You're gonna go onto hands and knees here. You're going to inhale, drop down, and exhale, pull up. Inhale, drop down. Exhale, pull up. Bring baby nice and close to your spine. From here, you can release to neutral. Do that about 10 breath cycles. Then you're gonna stay here and you're gonna wiggle side to side while on the block. You can go side to side, you can go back a little bit. Just kind of have fun here, just loosening up your SI joint and lower back. So you'll do, like I said, 10 times-ish on each side. Just kind of do what feels good throughout. And then you'll switch and do the same thing on the opposite side. Then you can grab 2 yoga blocks. You're going to place your forearms on the blocks. From here, you are going to bring your knees far apart, feet are together. And you're not going to go into child's pose, but instead you're going to stay here, almost like a dolphin pose. You're going to tilt your tailbone up and kind of just wiggle side to side. You can rock back and forth. Just kind of give baby some space. Create some space in there for them. Do that for about a minute or so. From here, you can take a yoga block, or you can use a birth ball for this next one. I'm gonna start with the yoga block. You're gonna bring one leg in front of you, one leg bent behind. You're gonna just kind of rock forward and backwards. You're using the block to steady your hand and help your balance improve. You're gonna feel a good stretch through the back of the leg. As you come forward, you're gonna feel a stretch on that opposite side. And just kind of rock back and forth 10 times or so on each side. So I'm gonna put the ball here. And just kind of back and forth movements. You can use your arm to push that leg open a bit. Just really think about opening throughout the pelvic floor region. You can take the ball. From here, you're going to lunge forward. You're going to, I'll show you on this side. So you're gonna lunge forward here, keep the ball on this side. Keep your tailbone tucked, so try not to really arch through your back. Try and keep your tailbone tucked, your core pulled in slightly. Reach up, grow nice and tall through here, so think about creating space between your hip bone and your lower rib cage. Bend over, lean forward a tad, feel a good stretch, make room for baby again. Take some deep breaths into that rib cage. And exhale, release. Inhale into your rib cage. And exhale, release. So do about 10 breaths on each side for that one. Then you can sit onto the ball. I always like to place it up against the wall so that you have a little more stability and some room to work with. You're going to place your foot out. You're going to do some scoops here. So you're going to scoop 10 times. So try again. You're not arching forward and crunching on baby. You're not arching too much through your low back. You're just kind of keeping your spine nice and neutral. You're going to scoop and scoop here. From this position, you're going to scoop 10 times. So then you're going to come out to a 45-degree angle. You're going to scoop towards the leg that's out. Scoop towards the leg that's bent. Scoop towards the leg out. And again, 10 times in each direction. From here, you're going to do some hip mobility. So inhale, arch forward. Exhale, come back. Inhale, arch forward. Exhale, come back. You want to do that for about a minute. And then, so you can see me again, you're going to go onto the ball. You're going to just go side to side. Okay. What I like to have patients do is a lot of this front and back, side to side motion to get baby into the canal. You don't really want to do too much bouncing on the ball. It's just going to kind of like jam baby's head up and down, up and down. We need to create space for baby to progress further. So more side to side movements, even sitting on the ball, you can stretch over, opposite, one arm to opposite knee, stretch here, stretch here. You can do some rotations here. Play around with what feels good and what feels natural for you, and then just reach out with any questions.